everyone, it is now day 90 post-op. I'm talking a lot better, I'm eating a lot better, and today I went to go and see my orthodontist for my 12-week checkup. So what am I eating now to begin with? I'm eating pretty much everything. I eat pizza, pasta, toast, you name it, I eat it, sausages. I'm even using my front tooth to bite into things now, and that's been happening for the last few days. Although probably could have happened a little bit earlier, but I didn't really feel confident to do it, confident enough to do it. So yeah, I've started doing that recently. I don't really think there's anything that I haven't tried eating. That sounds really bad. Obviously there are things I haven't tried eating, but there's not really much difference in what I haven't tried eating to what I have eaten, if that makes sense. So I've eaten like chewy bread, I've eaten, just all sorts of stuff really. And it's all gone down really well. Nothing really makes it swell up so much anymore. Obviously there's a little bit of swelling still there, but not too much. And yeah, my speech has gotten a lot better. I can talk more or less normally now. Although it's funny, as I'm doing this video, I think maybe because I've just had dinner and I've just been chewing a lot and I've been talking a lot today as well, I think, things maybe have gotten a little bit more swollen and awkward. But generally on a day-to-day basis, things have been so much easier. I don't feel like I'm struggling the way I was before, and I'm not so hesitant before I say anything. So that's really good. Things seem to be going really well in that way. So yeah, I went to go and see my orthodontist today. Like I said, it's my 12-week checkup, and he seems really happy with everything. He said that another 2 or 3 sort of adjustments to my brace, and then I'm going to be out of braces, so that'll be it completely, completely completed. So yeah, I'll finally be free, yay! Major uproar on that one because I'm so excited. Yeah, so he didn't really do much. He just changed the bottom wire to a thinner wire. So I obviously had the big surgical wires in there before. I don't need that anymore, apparently, not at the bottom anyway. So that's been changed, and the top wire, I still have the same top wire in that I had during surgery. All he did to that was he kind of bent it a little bit and twisted it so that it pulls my teeth some way or another, I don't know. Basically to get a better bite, because at the moment my top and bottom teeth are kind of sitting like that on this side, so I need to kind of pull them together a little bit like that just to close up that kind of bite, and it's the same on the other side as well. So yeah, I guess it's a bit of an open bite inside my mouth, if that makes sense. I can now move my jaw quite freely. I can move it out quite a lot, and it's quite wide. Still only just over 2 fingers width wide, but it's getting there, and every day it feels easier to use. The clicking's settling down as well, and the popping. So although I still get it from time to time, if I stretch my jaw like I just have, it did actually go a little bit. It does tend to happen more, but generally it is really settling down, and it's just not really a pain at all now. So yeah, that's really helping, and yeah, I don't have to wear my elastics anymore. That was the other thing. My orthodontist said I don't have to wear elastics, at least until my next visit, so that's brilliant news. I didn't really like wearing them. I did and I didn't. I didn't like them for having to take them off every time I eat and then having to put them back on again, and it's just such a pain. If they snap during the night, they wake you up, and things like that are just a little bit of a pain. But actually I kind of like the sturdiness and the structure that they gave to my jaw when I had them on. So I miss them in that way, but yeah, in every other way I really don't. So yeah, that's good. Maybe on my next appointment I will have to have them put back on, but who knows, that's 4 weeks away. But yeah, I think everything else is all good. I mean, it's still slightly, my top teeth are still slightly off centre compared to my lower jaw, but I don't know if they're that worried about it. It's close enough, so I think they're just probably going to leave it as it is. And yeah, sensitivity wise, I mean, all the sensitivity has completely come back under there. At least I think it has. It either has and it definitely has, or it has and I just think it has and I've just gotten used to it being numb. But I think it's come back. I mean, I can feel all of that, so yeah. If I can feel it, it must be there, right? I still can't feel my top gums. Not really anyway. I can feel if I really push hard, but who wants to do that? And I have I still get the weird sensation of coldness on the outside of my face, but not as much as I was getting. The roof of my mouth I don't feel any pain at all now, whereas I did really badly before, and my surgeon did say that that was probably nerve pain, when I guess he was right because it's gone away. But in its place I now have really bad, I mean bad, like the worst toothache you've ever had kind of bad pain in the top left hand side. So, and this is just when anything comes into contact with a certain tooth. Now I know it's not the tooth itself, it feels like the nerve pain again. So I did ask my orthodontist about it today and he just said, yeah, it's probably sensitivity caused by damaged nerves. So as the feeling comes back, it's going to be hypersensitive and then eventually it will die down, hopefully, fingers crossed, into nothing. Or not nothing, but just normal feelies. So yeah, everything seems to be going well. I hope I look okay. I certainly look different. Lots of people have been giving me comments on how different I do look, and they've been better comments recently, I think because the swelling has gone down and people can see what it actually looks like. I had one today that was, oh, you can really see why they wanted you to do it. So that was nice, I think, because I didn't think I looked that bad before, but maybe I did. But who knows. So yeah, all good, and I thank you for watching once again. When I have my next orthodontics appointment, I'll probably do an update then. I doubt I'll do one before because I'm so busy again, doing this, that and the other. But yeah, thanks for watching and I'll see you next time. Bye!